So in doing that, that can cause the baby to go into a less than optimal position, which is going to make it harder for you to give birth. Does that make sense? Okay. So, a number of things that I do with my pregnant patients, and if you go to a chiropractor that's a specialist in pediatrics and pregnancy, you can have these things done as well. The first thing is getting the spine aligned. I want the pelvis balanced. I want the uterus to be able to be nice and straight and not twisted. This helps the baby go into the best position. Another thing that I do is called myofascial release. This is another way, if your pelvis is twisted, over time, that torquing, even when I get the bones aligned, the soft tissue can be torqued. So there's a technique that I use that helps to get that soft tissue released. This was one of the problems I had during my labor, was just because of my job, and this is one thing that we as chiropractors talk about, because probably about 80% of my peers, meaning females that are chiropractors, have had trouble giving birth, which is very funny because chiropractic wives have great births and our chiropractic patients have great births, but we as women who are chiropractors don't. And the reason is, and we've talked about this at different conferences, is because all day long I stand at a table and I turn so I'm aligned with the patient's spine and I bend over them like this, which means all day long my pelvis is torqued and I'm twisting all that soft tissue. So, and during my pregnancy, that was one thing I just wasn't able to teach my husband how to do, who's also a chiropractor. And as I was giving birth, I'm like, why didn't I teach somebody how to do this? But that's one of the things I do for my patients, and that helps to relieve all of that torquing. That torquing can occur if you had a major fall. It can occur from car accidents because the way our seat belts are, you know, we whip one side, rather we would be whipping this side because one shoulder stays firm and the other one goes forward. Or it can happen if you have a job like mine where all day long you're doing something where you're constantly twisting and torquing your pelvis. Another thing that I do with my patients is cranial work. This is another thing that most people don't realize chiropractic can help with, and that's to help balance and improve your body's ability to release hormones effectively. Your pituitary gland is up in your head, and by doing the cranial work, I can help to make sure that that pituitary gland gets milked effectively so that during labor, you're putting out the right, your body can easily put out the oxytocin that it needs to keep increasing contractions. When we talk about birth and how your body already knows how to give birth, one of the ways of increasing that potential is that your body has to be able to communicate with your brain. And this is another area where subluxations come in, because not only is it information that goes out that gets blocked, but the information coming in gets blocked. So as the baby is pressing down on the cervix, your brain may not be getting the right information to know how hard that pressure is, how much you've stretched, how much more hormones you need. And so it may not, it's just not getting the right information, so it may not be letting out the right amount of hormones, which may lead to stalled labors. In my practice, what I do is I work with people leading up to the birth so that we can have you as ready as possible, but then also I'm available to come and work during labors. One of the greatest gifts in my life was that because of the chiropractic care and because of the homeopathics that are used in my office and Dr. Jennings' office, I didn't have to have a C-section. And I am fully convinced that if I didn't have either one of those things, Dr. Jennings actually came to my house at 3:30 in the morning, 4:30 in the morning, something like that, and worked on me, I know I would have ended up with a C-section because baby just wasn't descending right. He had his arm up around his shoulder, and there was just blockages in my body and my emotions to having the birth continue on. And if I had been in a hospital or if I had not had that extra care, we would have gotten to one of those situations where someone would have told me, oh, you can't do this, the baby's not descending, the baby's not doing this, and I would have ended up with a C-section.